Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 9 additional deaths related to COVID-19. A male in his 20s from the Winnipeg Health Region, a female in her 50s from the Winnipeg Health Region, a female in her 50s from the Northern Region, a female in her 60s from the Winnipeg Health Region linked to the outbreak at the Kikinin Centre, a female in her 60s from the Interlake Eastern Region, a male in his 60s from Southern Health, Santé Sud, a female in her 80s from Winnipeg Region, a male in his 80s from Winnipeg Region linked to the St. Norbert Personal Care Home, a male in his 80s from Prairie Mountain Health Region linked to the outbreak at Gilbert Plains Personal Care Home, and a male in his 100s from Winnipeg Region linked to the St. Norbert Personal Care Home outbreak. So we are sending our condolences to family and loved ones to all of these individuals. Our current 5-day COVID test positivity rate is 13.7%. Both provincially and in the Winnipeg region. 438 new cases of the virus have been identified as of 9:30 a.m. One case was removed due to a data error, so 437 net new cases, bring our total to 12,919. Tuesday, I had to announce the death of a woman in her 30s. Today it's a man in his 20s. And so, again, all these announcements are much more than numbers. These are people. This is a young man. There are certainly some underlying conditions, but this is, tragic to see all of these listings every single day now, and we have to maintain our focus that these are not just numbers. These are people. This was a son, Manitoban, and we need to continue to be vigilant to try to stop days like these going forward. We're addressing some of the cases in Southern Health, Santé Sud. Over the last number of weeks, we've seen the case numbers continue to increase in that region. We have some specific data to share to raise the importance of practicing the fundamentals and adhering to the orders, especially in those regions. In Steinbach, the 10-day test positivity rate is 40%. 40% of people getting tested are testing positive. You're seeing about 30 to 40 positive tests every day, just in Steinbach. In St. Anne-la-Brocquerie, it's 20% test positivity. In the rural municipality of Hanover, the 10-day test positivity rate is 30% and climbing. And like we said, for comparison, the Winnipeg region is 13.7% today. In Steinbach alone, we have 3 personal care homes that have declared outbreaks. 3 assisted living facilities have declared outbreaks. Bethesda Regional Health Centre is seeing high volumes of COVID patients. There have been 24 deaths in the community since the start of the pandemic. So we're seeing a lot of disproportionate numbers, and we need to end that. We need people to follow the orders, staying home, leaving only for essential reasons, reducing our contacts, and we need to continue to try to bring down these numbers. As I drove to work this morning, I was thinking about the public health orders that we initiated in spring during the first wave. And I remember driving to work and the streets were empty. I remember parking on the street and there were no cars to be seen. It was empty, it was quiet. Kind of a surreal feeling at that time. Driving to work today, the streets were full. Much different than what we saw in the spring, and in this, our current restrictions are much more stringent than in the spring. We are at a critical juncture right now. Our hospitals are reaching capacity. We need to do better. All of us. We need to be staying home for the most part, going out for essential reasons. And when I say everyone, that means individuals, it means employers. So employers, we need you to support employees to be able to work from home as much as possible. Like I said, in the spring, we saw much less traffic, so we were able to do it before. And so we need to do that now. And we need to support employers stay home if they required to self-isolate. We should be doing things virtually if possible, and ensuring we have safety protocols within the workplace and to ensure we're limiting the risk of transmission. This morning, the updated public health orders are in effect. So it limits retail operations to selling just essential items. You know, these Black Friday sales are tempting, and hopefully people can take advantage of them online or curbside pickup, but non-essential items will not be able to be sold in person. I encourage you to shop local and online as much as possible. These local retailers do need our support during these tough times, and there are safe ways of supporting them. Retail operations must comply with the capacity limits, 25%, but not to exceed 250 people. They must implement measures to ensure physical distancing. And we have plenty of enforcement options available for businesses that are not going to comply. We're continuing to see over 400 cases a day. Our healthcare system can't be sustained at that level. We need to change this around, and we need to change it around now. We're reporting more than 8 deaths a day, and as we note today is a person in their 20s. It's hard not to see these numbers and the reporting of these unfortunate deaths as very daunting. But again, this isn't going to be forever. We can overcome this like we did in the past. We know exactly what to do. We'll stay home, we'll keep our contacts low, and we won't be like this forever. We will be able to move on. We'll be able to loosen these restrictions, and one day we'll be able to get back to normal. It's just we can't do that now. We have to be able to get through this without overwhelming our healthcare system. So please, let's take this action together. We're going to stay home, reduce the number of contacts, and we're going to start seeing these numbers come down. So thanks again, Manitoba, and we'll pass it to Lanette.
Thank you very much. I want to begin today by thanking the grade 5 and 6 students at École George V School in Elmwood, led by their teacher, Sarah Dorian. Students from that class sent drawings earlier this week with messages of appreciation and support to the staff at Health Sciences Centre. Their drawings are on the screens for all the staff to see. They're rotating regularly. And the messages that stand out the most for me from these young students is their promise to ask their loved ones to stay home and do their part. That's really all we're all asking. And we really appreciate the commitment from these students. as we saw in the spring, messages like this go a far way in lifting the spirits of our healthcare workers, especially now. They are feeling tired, they are feeling stretched and scared during this time. These messages also serve as an important reminder that we all have a part in reducing COVID-19 and reducing the threat that it poses to our loved ones. These children, they get it, and they are doing their part, and we need all Manitobans to do their part. So just a message to those kids in Elmwood. We very much loved seeing your creative work, and I know the physicians and the staff at the Health Sciences really appreciated it as well. So thank you, and keep them coming. We need to stay home. We need to stay safe. We need to protect our loved ones, and we need to protect our health system. We are all tired of this virus. We are all tired of the limitations that it places on our social lives. We all know businesses that are suffering. We all know people whose employment has been impacted by the measures that are in place to manage the spread of the virus. But most of all, we are tired of reporting the cruelest impacts of this virus. It took 248 days for Manitoba to record 100 COVID deaths, and it took only 13 days for us to double that amount. We're now up to 208 deaths, 208 families that are in mourning, 208 families that have been unable to properly grieve for their loved ones, to gather together and support each other as they remember the person they lost. This virus is robbing us all of pieces of our normal lives, but it is robbing families of their loved ones. And we can do something about it, and we must. So each of these individuals who we've lost is so much more than a number. They were loved, they are missed, and they won't be forgotten. 90 people are in hospital today due to COVID. We have people of all ages and from all walks of life in our hospitals right now. There's no denying our elderly population is hit the hardest by this virus, and it is reflected in our daily hospitalization reports. However, we also have people under the age of 40 in our hospitals. We have people in their 20s, teenagers, and we have children. We even have a baby right now with COVID-19. So when I returned to these briefings nearly a month ago, there were 83 people in hospital, and that number has increased by 338% in less than 4 weeks. 100 ICU beds are currently open across the system, and as a reminder, the number of these beds will always fluctuate based on the need. 90 of those beds were in use as of midnight. Nearly half of the ICU patients, 43 of them, have COVID. 33 of the 66 patients who are ventilated have COVID-19. And we have now postponed 872 non-elective and elective surgeries in the past 25 days. Our staff continue to do all they can to manage. The health system still has plenty of moves left to make. We can add beds, we can redeploy staff, we can open up new spaces, but we're still going in the wrong direction. I want to give a special mention to our emergency response team. They have developed, as of a couple of weeks ago, a rapid deployment service. They've been hard at work for the past week for sure, a little bit longer, providing on-site care and staffing at personal care homes that are experiencing outbreaks. And as a reminder, these rapid deployment teams provide short-term intervention so that the residents in the care homes don't have to be transferred to hospital if they can be more appropriately cared for in their home. The ERS support team has been on site this week at Gilbert Plains and Fairview Personal Care Home in the Prairie Mountain Health Region, as well as Golden Lynx Lodge in Winnipeg. At Golden Lynx Lodge, they have, as of last evening, 42 residents who have been diagnosed with COVID, and there were 12 cases at Gilbert Plains and 18 at Fairview. The rapid response teams have been working with the medical staff and the nurses and support teams to help the residents. They're helping with medication administration, they're doing assessments and providing IV hydration while they're there. And they will be expected to stay on site for the foreseeable future while the the needs are high, and then they will transition to the regional supports that are put in place. These teams are all working incredibly hard, taking care of our most vulnerable Manitobans. So I just want to express my sincere thanks to everyone who is working very hard, but most especially these emergency response team members who can jump in pretty quickly and mobilize additional support when we need them. So thank you very much. And with that, we can open up the lines to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up. Up first, from the Brandon Sun, Kyle.
Good afternoon. I was wondering if either of you could divulge any more information on the outbreak at Fairview. I know you mentioned recently, Ms. Siragusa, that there are 18 cases, but is there any other information you could present at this point about the ongoing outbreak?
Do you have more information?
Yeah, no, I don't think we have anything further other than the amount of cases there.
Okay. And in terms of a follow-up, I've been talking with a couple people this morning about how they believe that gyms and those kind of facilities are kind of an essential service during this period, specifically when it comes to keeping their mental health in check. So I was wondering if you could respond to that and potentially provide some alternatives to people who are looking for that, at home.
I mean, definitely physical health, mental health, being active are essential. And I think that, related to gyms and things, remember, we're at a critical juncture here right now. Our message is for people to stay home. So although there's a lot of benefit to being at a gym and being physically active, right now we need people to stay home. And so we're not looking for ways to encourage people to leave their home right now. So a lot of activity can be done at home. Even without a lot of equipment. Walking right now, weather is still reasonable, and different body weight exercises and things. So there's a lot of opportunities at home in the short term, so I'd certainly recognize lots of benefit from gyms. But I think that right now, relatively short period of time, we need to stay home. So we're not looking for ways to encourage people to go out. So stay active, stay fit, and we'll get those gyms open as soon as we can, because absolutely they provide a lot of benefit.
From CJOB, Elisha.
Good afternoon. I'm going to go off topic a tiny little bit. We're seeing a lot of misinformation around COVID-19, the flu, on our social media pages. So, Dr. Roussin, can you explain clearly for people why the coronavirus is spreading so rapidly, but influenza is not? What are the factors behind that?
There's a couple things. I mean, simply put, is they're different viruses. right? So when we're dealing with this coronavirus, this novel coronavirus, we have essentially universal susceptibility. Nobody has immunity or even partial immunity to it. So when you get a virus like this, it can easily be spread. Where influenza, where we get the flu shots every year and we have the benefit of a vaccine, there's always some underlying immunity there. So not to play influenza mildly though, influenza causes thousands of deaths in Canada every single year. So they're both very serious viruses, but because this is a novel virus, because we have a universal susceptibility to it, and because right now its severity, its case fatality rate is just multiple times that of influenza. This is why we're seeing this. So, influenza, we haven't seen a lot of activity of it yet in Canada. We have to protect ourselves. We all have to get that flu shot because we don't want that situation where both influenza and COVID are circulating rapidly. So we have to do what we can to protect ourselves. The good thing is that the measures that we take to protect ourselves against COVID also protect ourselves against influenza. So, so we'll be watching both viruses closely.
Thank you. Going back to Steinbach's numbers with the test positivity rate of 40%, is there any indication this is linked to last week's rally at all at this point?
I don't have any direct linkage to that. To be, any case investigation we do is reliant on history and things like that. So I don't have any direct links to that. I just think that in the area we saw the trend for some time as we added southern to Winnipeg's red earlier. But these numbers here, when we, of course, in smaller areas, the same thing we always talk about when we talk about the test positivity rates. With lower denominators, a lot of variability. But when you're looking at something like 40%, we just know this is a very concerning number, and we need things to change in that area right now.
From the Winnipeg Sun, Scott.
Hi, good afternoon to you both. Scott Billick, Winnipeg Sun. I guess, kind of piggybacking on Alicia's questions there regarding Steinbach. I mean, 40% is very high. You've been hesitant to talk about those test positivity rates in those areas. But I don't know, like that number seems out of control. What can be done in that area above and beyond what's already being done in the rest of the province to kind of get that number under control?
Well, I mean, adherence to the restrictions we have in place right now, effective today, will get those numbers under control. So we have to ensure we have adherence. We're messaging here to try to highlight the importance of acting right now. And we'll look at other measures going forward. But 40% is just given even the underlying variability of that. 40% is just so important that we get everyone on board right now.
Thanks for that. And my follow-up is, you talked in your preamble about when you're going to work in the spring, going to work in the summer. I imagine some of that has to do with schools still being open. We've been asking about this the whole time, but I mean, if you want employers to keep their workers at home, wouldn't that be made easier by having a reason to stay home, such as kids? I mean, I know there is a reason to stay home now, but some workers aren't cooperating, or some employers aren't cooperating. If you close schools, would you not see more people just staying at home?
Well, I mean, it depends, right? We might see, some disproportionate effects of that. Now, in saying that, this is something that we've continually looked at and we continue to look at. Where are we with the benefit of schools? We know that's so high, having in-class learning. But then we know with it there's other things, right? We have rising community-based transmission. We see a lot of cases in school. Haven't seen the transmission yet, but it is something that we're looking at. And some of the points you make are do get to some of that. So we haven't landed on anything for it. You've heard us talk about the holiday break, some deliberations on that. So these things are all are all certainly being looked at, and as well in other jurisdictions. So we'll have more to come on that.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. Gavin from Radio Canada here. I was wondering, with this surge in Steinbach and in that region of Santé Sud, do you have any idea where these infections are coming from? Is it just within large families, some sort of gathering? What can you tell us about that?
Yeah, and it's much like we see in Winnipeg, and that's what makes it more difficult to target, is it's widespread community-based transmission. So we're seeing transmission within families, transmission from gatherings, transmission in the workplace. So it's just really widespread. So we can't have a targeted intervention. That's why we rely on these widespread interventions, because we just need to try to get people to stay home, reduce those amount of contacts, because we can't pinpoint where the transmission is right now.
In Quebec, there's been this idea of permitting small gatherings around Christmas, preceded and followed by a period of voluntary quarantine. Is that something you consider, and what do you think about that proposition?
Looking at, definitely we're going to have some targeted messaging and targeted advice around the holiday season. We don't have anything yet because it's largely going to depend on what these numbers do. So that messaging is going to look very different if we have very successful uptake of these measures and our numbers are much improved by that time, than if we're still trying to find ways of limiting the ongoing transmission. So we definitely are looking at ways to message, and we're going to have some specific recommendations, but we can't land on those yet until we see what these numbers do.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. We're hearing some complaints today about the decision in the order to not allow the sale of gift cards and cash cards. They're available online, but a lot of low-income people don't have credit cards. There is a concern here that this is effectively taking essential purchases away from people who don't have credit cards.
Yeah, and I think this is when we write these orders, we tried messaging, for a long time. For lots of reasons, we didn't get the effects, so now we had to put these very targeted, very restricted, and black and white restrictions in. And then, like I said, it wouldn't surprise me if we find out some things that we later discover that we want to put in. And so I think this is an example of that. Right, so I think these are something we're going to look at in the near future, because you're right, having access to these could make online purchase much easier for people who say don't have that credit card. So yeah, this is just one of those examples that comes up. No doubt we put a lot of time into to try to get these things, but they're so restrictive that I'm sure this won't be the last thing that we come up with.
Thank you very much for that. And further on Steinbach, one of the things we've seen in other jurisdictions, not in North America certainly, is when you get a community like Steinbach that has extreme spread, is the presence of some kind of proactive enforcement. We saw in Italy and Spain, police in the streets, just driving down the street saying, stay at home, playing music at a loudspeaker. Is something very targeted to that community, as you say, on the table?
Well, we don't have anything specific in that regard. I think the messaging with these overall restrictions is that we are going to be enforcing them. We've upped our ability to enforce, and it's going to be a major strategy in these restrictions. And then for sure, when we see areas where we have real concerning spread, then we might have to do a bit more targeting type of things that are proactive, but we don't have anything specific to that at this point.
From the Canadian Press, Steve.
Just carrying on the Steinbach issue, the 40% test positivity rate is a bit of a shocker to me and my layman's eyes. You said that if we adopt, if everybody follows the rules, the numbers there will drop, but it just seems like so high that it will not maybe fizzle out on its own. Are there more things you can do under the Code Red to bring those numbers down?
Definitely, quite concerned when we see a number like that, and then that it's persistent. It's not just based on variability of low numbers, and so we are looking at other strategies because we want to ensure we're protecting people in an area where there's a lot of transmission going on. So right now we have these restrictions on. They're just into place today, just into effect today. They're the most stringent restrictions we've had to date, and if followed, we'll see numbers come down, but we will be looking at other approaches as well.
Okay, my other question is on Golden Links. The care home brought in paramedics, as Ms. Siragusa mentioned, and they asked family members to come in, don some protective equipment, and sit by the bedside of their loved one if they could to monitor for any changes. How worried should we be about a care home relying on family members to come in and monitor the residents? Is that safe to have lots of people coming in from the community to sit by the bedside?
Yeah, great question. So that was an initiative by Golden Links Lodge. I believe the communication went out yesterday evening. And I will just remind you that the visitor guidelines changed from the spring. I think it was in the summer, maybe a little bit later spring, where we really kind of shifted that it wasn't going to be a total lockdown in those personal care homes, that we were going to value the role of designated caregivers. So caregivers have continually been allowed to go into the personal care homes to see their loved ones because we saw more benefit than risk. In the situation that's happening with Golden Links Lodge, obviously there is a significant outbreak, including their staff has been sick as well. And so we're working on getting additional supports. I've been in contact with the WRHA multiple times since last evening, and a stable approach is being put in place. The offer of loved ones and caregivers to come in is not to replace the clinical care that they need, but to be a support to the residents. And there may be things they can certainly do to help out and flag for clinical providers who are quite busy at the site right now. I have also confirmed that there will be PPE available to family members. There will be training and education. I believe WRHA said that there was going to be an infection prevention and control team there to support them. And this won't be, of course, business as usual. There's no wandering around the PCH. If you're there to see your loved one, you go directly to your loved one. You have the protection you need, and it's probably good for both the caregiver and the resident to have each other close by. So that's what the site has decided to do, and I think they've put the safeguards in place, and they have considered the human factor of this outbreak. So they're proceeding like that.
From CTV Winnipeg, Michelle.
This morning, the federal government released some modeling and some data that compared, Manitoba to other provinces. In it, it showed our rate is very high, and also our number of hospitalizations is very high. I'm just wondering what you guys are taking away from these models, and also how do Manitobans use this information?
Yeah, and so these models and models other models we've seen, this is what's led us to implement the most restrictive orders that we've had to date. And so we know that we can't sustain these daily numbers. Our healthcare system won't be able to sustain it. So we do have high active cases. We have high amounts of admissions to both medicine and to ICU, and it's not sustainable. And so this is all the basis of these restrictions and our messaging to Manitobans that it's so critical right now to stay home. Limit your contacts outside your household, leave only for essential reasons, because we just can't sustain these numbers much longer.
Okay, and then also, can we get a clarification on what can be sold today? I know today people and businesses are given some time to rope things off and take non-essentials off their sales floor. So can you kind of clarify that?
So what can be sold, though all of those restrictions in their entirety came into effect at 12:01 today. So non-essential items cannot be sold right now. The bit of that grace period was to give businesses the ability to remove those non-essential items or to separate them from the essential items. So no one can sell a non-essential item beginning at 12:01 in effect right now. But there's just until 12:01 tomorrow, they have the ability to rope things off or separate them in some other manner.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question is for you. Just on the back of Golden Links Lodge here and family members now being asked to go in and help out, it seems very extreme at this point. And I know the staffing issues are what they are, but I guess if you're watching this at home and you're being told that you got to come in and help take care of your folks, I guess, can we get more staff in? I mean, where are we at with staffing right now in personal care homes?
Yeah, so they have had quite a reduction in staffing because of COVID transmission. The ERS team, the paramedics are there right now, and they will stay there for the next few days to get the situation stabilized. There are additional people who've been brought in. There's an IV team that has been going in. They've put some more staff, and they will be redeploying over the coming days and weeks. So what we're looking at is redeploying additional healthcare assistants and nurses for probably a 2-week period until December 5th, where we can get things stabilized there. But to be clear, the caregivers are there because they're taking care of their loved one. Our goal is not to rely on them to provide the clinical care directly so much as to support their loved one and advocate for them while in this busy time. But the WRHA is committed to redeploying more people to support where the need is. And there are other PCHs who are struggling too and have been able to direct the staff there to keep it stable. So that will happen with Golden Links too. We will find the people and make sure they're there.
Thank you very much for that. Do you have an update on how many now personal care homes have been impacted total in either Winnipeg Regional Health Authority or the province so far?
I think the last time I saw it was 27, but we can double check that and get back to you. And 27 sounds like a big number. It is a big number, but that is indicative of one person has COVID. There's different degrees of outbreak happening right now.
From CHVN, Taylor.
Hey, good afternoon. You mentioned earlier that a baby had contracted COVID-19. What do we know so far about infants and birthing during this pandemic?
Well, we've had a number of women contracting COVID when pregnant. I'm not aware of any complications, and we know that there's women who are infected who give birth. There is certainly a risk for the infants to acquire it. So not a whole bunch of information, certainly not in our jurisdiction. There's not many newborns that we would have that were infected. And so we just have currently the one that I'm aware of in hospital at this point.
And a lot of parents might be concerned hearing about this. What advice do you have for them?
Like parents with young kids?
Yeah.
Yeah, I mean, this is a pandemic, and there's no one who is really immune from it at this point. And so it's so our message is clear. Our message that we give is to all Manitobans. To earlier on to practice the fundamentals, it was for everyone. Right now, staying home as much as you can is for everyone. So we need to decrease the risk of transmission. Certainly, we know that the escalating age is a major risk factor for this. But unfortunately, we have young people in hospital. We've announced young people who have died. So this can affect anyone, and there's different risk levels, but no one is risk-free from this. So everyone needs to follow the public health advice. And again, it's short-term. We're stepping up right now to protect the most vulnerable. It's not always going to be like this. And it's not even going to be like this for long. If we get these numbers down, we can start easing these restrictions again. But we have to really step up right now.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. I was hoping you could tell us a little bit more about what provincial and regional resources are being marshaled to the north, particularly in the PAW, to handle the surge in those communities and some of the severe outbreaks at PCHs.
Sure. So through our incident command, as you know, there's been a lot of planning that has happened in terms of what do the models of care look like, how do you, in the long-term care example, some of the planning was having each PCH having a site, an acute care site where they can support each other. So for example, right now, many staff at the Victoria Hospital are supporting a PCH. So as much as possible, we're deploying from within. The first, I don't want to say it's easy because it's not easy, but the first wave usually is looking at elective surgery, endoscopy, sometimes diagnostics, and redeploying from that end. But then we start looking at other layers beneath that we provide service to. And like home care as an example, looking at what is the most essential thing that we need right now to support where the demand is. So home care is one thing, but there's lots of other services that we provide that we would have to re-examine and determine, can we put this on hold for a little bit while we support the residents and the patients that are having an outbreak. Specifically in the north, the way we have it working is that each local area identifies when they have problems. Sometimes they have COVID and they're managing fine. Sometimes they need additional resources. So they will work with the regional health authorities. So obviously Thompson would be talking to Northern Regional Health Authority. We also have, through the University of Manitoba, Ongamizin is a group of clinical providers who have always been dedicated to service in the north. And early on in the pandemic, they developed a rapid response team that has been going throughout Manitoba and doing amazing work. So they've been to Little Grand Rapids and they've been to Cross Lake, and anywhere there's an outbreak, they send a team there. So they are working also. It's really a collaborative of people who are helping out from the university, from the regional health authorities, from the communities themselves, the leaders, as well as if we need to escalate even farther with the Red Cross, for example, that follows a pathway too. So that's a long answer, but there's a lot of people who are involved in the response and determining where we shift resources to support.
Sure, thanks for the explanation. I was also wondering today what the review of PPE use and those guidelines have has so far determined about what changes might be necessary, given the community transmission today?
Yeah, good question. So PPE is always on our mind. We have been, since the community spread has become so evident, and the risk to our staff who are working in facilities, we have taken a look at the PPE guidelines again. Just refreshing, does the evidence support what we have as guidelines? We've also been in discussions with other jurisdictions and of course our clinical experts here at home through IPNC and staff health. So we are looking at it again. For the most part, they're quite comprehensive, but I think we can do a better job just in making sure that there is education, ongoing education, potentially some audits where we can, not to judge at all, but to learn where there's opportunities to improve, and also ensure that all staff people have the access to the PPE that they require, and especially we have enough PPE. We're constantly talking to logistics, so it's still a little bit more to evolve, but we've been focusing on it quite a bit for the last few weeks, and any changes we will probably report in. I would think next week we'll be able to report some changes there.
From Global, Kevin.
Good afternoon. I know that we're only about 12 hours or so into this latest set of restrictions, but if these numbers stay where they're at right now, what is the next step? And will you wait maybe 10 to 14 days, which you usually talk about, to implement a new set of restrictions? Or will this be something maybe we see next week if the numbers remain where they are?
And so certainly we have to have an idea on what, how we would react if we didn't see a beneficial response to this. And things that that we'd look at is just really all that's left is our list of what's critical, and so whether we further narrow that down is is another option. So we don't have any specifics, but these are the type of things that really are the only things we have in our back pocket now. Of course, we look at schools and things, but like we discussed, we're not seeing that as driving the transmission. But of course, we review that all the time. And so as far as the length of time, I don't think we have to be committed to a certain time frame. We've articulated here that we can't sustain these numbers, much longer. So we need to see a change. So if a week goes by and we're not seeing any indication of benefit, then we do have to consider making a further move.
Okay, and for Nurse Siragusa, are we any closer to seeing field hospitals being set up?
I don't think field hospitals at this point, but we are looking at, and just so we're using the same language, lower acuity centers where patients would go if they were stable, non-COVID, in a bigger area. So we definitely are looking at that now. We are putting a team together who would organize the logistics. The timing of the go live is yet to be determined, but the more we watch these numbers not coming down, the more likely that is to happen in the coming weeks to months.
From the Carillon, Josh.
Hi there. I'm interested to know how far the government could go with these restrictions. In September, Quebec police were authorized to demand proof of residency, and if residents refused entry, police could actually obtain warrants virtually, from what I understand, and issue tickets. If cases don't decrease, will Manitoba Public Health recommend this to decision makers?
I think sort of detailed enforcement options, especially like the authority of officers, that's not going to be really coming from a public health recommendation. I think it's clear that we have these restrictions in place. We think with good adherence to these restrictions, we're going to see those numbers come down. And so with that comes the need for enforcement, and we have a table working on what are the best ways to enforce these orders.
Sure. And I guess given the number of cases now in the southeast, do you anticipate a much worse hospital capacity situation in the southeast in the coming weeks?
Well, this is the concern, right? The overall case numbers. There's a small yet predictable amount of those that will be admitted to hospital, and a smaller but yet again predictable number that will be admitted to ICU. And so the larger the case numbers, the more we expect of these admissions 7 to 10 days down the road.
From the Globe and Mail, Shannon.
Good afternoon. My question is about funerals. I know we're just into new restrictions, but speaking to those in the funeral industry, there's concerns that they haven't been given consideration in terms of gathering size, particularly because around pallbearers, limit is 5 people, you need 6 to carry a casket. Has there been any consideration given to changing the regulations around funeral gatherings?
And this is another example of many examples, the challenge, the difficulties that this virus is posing for so many people and so many sectors. Right now, our ICUs are nearing capacity and our hospitals are filling. We need to change that. And so we need to keep gatherings down. So this virus isn't interested on how important a gathering is. It just spreads in gatherings. And so right now we have that gathering size of 5. That's puts tremendous difficulties on many things, including funerals. And like we mentioned, it's hard to imagine, losing a loved one, and having to navigate all these orders and having to navigate through this pandemic at the same time. But we can't sustain the numbers we have now. And we just know that settings such as gatherings, funerals, weddings, all of these things are just known transmitters of the virus. And so, albeit very strict, albeit very challenging for people who are already going through challenging spots, we are not considering expanding that number at this time. We're just at a critical juncture.
Thank you for that. My second question builds on that in that case. If we're talking about gathering sizes, I understand that there are going to be 2 new Hallmark movies that will start filming in Manitoba, in Winnipeg on Monday, and that there's another production, a movie called Esther, that's going to be filming in the city until December 14th, and that all of these productions require a large number of background actors that will be appearing without masks. So I'm wondering how it's come that these gatherings have been okayed, if there's an epidemiological reason for allowing film production to go ahead.
Yeah, so I don't know the details of these. We can look into that. Certainly we have workplaces, right? All of Schedule A in the orders is a list of workplaces that are allowed to still operate. The group size of 5 doesn't necessarily or it doesn't apply to them, but there are expectations of adherence to distancing, to ensuring people aren't showing up when ill, to allow virtual work whenever possible. So we do have ongoing workforce, which the Group 5 doesn't apply to, but there should be many safeguards in place to minimize the risk of transmission.
From CBC National, Cameron.
Hi, good afternoon. Lanette, hate to hit you with a bit of a morbid one at the end of the week here, but do we have any sense of excess mortality across the healthcare system right now? People that perhaps are avoiding hospital care, overdoses, suicide even?
Yeah, we are seeing the numbers in emergency starting to come down a little bit like we did last spring. So, except for in Bethesda, that's still busy. But it's hard to say what's going on. We are not in the hospital anyways, aside from the COVID, the expected deaths. We're not seeing much change in that regard. We're not seeing, we are tracking complaints, not seeing anything yet on that, but we certainly are going to watch that closely because we do worry that people need medical care, maybe aren't coming for medical care because they're scared to come in. I would also say, though, that we have invested and are supporting as much as possible virtual care. So if specialists or primary care providers can reach out to their patients virtually, that's kind of the what I hope and think is going on. But we haven't seen any data really to show us that the morbidity is going up, other than obviously the COVID deaths that we're tracking very closely.
And Dr. Roussin, today the Prime Minister announced that the border will be closed till the end of December. Given North Dakota and South Dakota right now are basically the two worst COVID jurisdictions in North America, and with rates of infection about 10 times Manitoba, even with the border closed, does sharing a border with North Dakota right now give you any concern, given just how high the numbers are down there?
Well, I think with this virus in a pandemic, it's not enough to just concern yourself what's happening in your jurisdiction. It's we have to know what's happening around us. I think with the border closures, definitely required for the time being. And so that would be my major concern, is just the ability of people to travel back and forth across that border. And so the current restrictions dramatically reduce that risk. And so that would be most at the forefront in my mind. It's very unlikely we're going to see that restriction lifted in 2020.
Thank you for that. We have time for just a couple more questions. Please proceed.
Hi, Doc. Ms. Siragusa, further along the line of Cam's question, are you aware of any excess mortality due to PCHs palliating their non-COVID patients rather than sending them to hospitals for medical treatment?
No, I'm not aware of that. We still have space in the hospital. Consultation would always happen with the family, with the primary care provider and the specialist. Guidance would be given. And if people need critical care, if they need hospitalization, we are absolutely ready to accept them. So I have not heard that. And I actually have asked that and haven't heard anything to corroborate that.
I've heard of anecdotal reports of it in families deciding, in consultation with their doctors, to avoid hospitals at this point. Do you hear any anecdotal reports like that?
No, I don't. I mean, healthcare is life and death decisions all the time. Like that's the business of it. So I think, when people are deciding to go to the hospital, to have intervention, there often is a conversation about that, and it's really personal based on individual situation. And so we certainly in the hospital would not deter someone if they needed care and could benefit from the care and want to come for care. They are welcome to come to the hospital.
And Cam asked about suicides and overdoses. We've seen some reports out of BC on this. What can you say about mental health and mortality right now?
Well, mental health mortality doesn't always come in through the hospital system, so that would be a question that we would have to ask our chief pathologist if there's any changes that way. But in terms of the mental health as it relates to COVID, obviously there's an increased chance for depression and anxiety, and the long-term impacts of what COVID, the way it affects people we'll have to keep learning about it because it's certainly a disruptive time for everyone. But yeah, it's hard for us to get that information, Bartley, because we don't always see it in the hospital necessarily.
Thanks. Sorry for the down.
Dr. Roussin, Scott Billick from the Sun again. Do you know the number of people out of the, I guess, 207 now that have died with no comorbidities, like people without underlying conditions? And is any follow-up being done on maybe why? I know there was that one, I think it was a man in his 40s who died, and he reported no underlying conditions. Has anything been learned about that, or are they just kind of, I don't know, freak scenarios where people are dying even though they are, medically healthy?
Yeah, so, we don't have a lot of details on that. I would say that, when we find, there's a lot of misinformation out there as well about sort of on the opposite, that people are questioning how concerning COVID is because most people have underlying conditions. Well, most people who die of anything have underlying conditions. You're very, very hard pressed to find many certificates of death that list only one cause. Most people who die, especially in the later years, will have underlying comorbidities. So it's not that it's just in COVID we see that. It's pretty much in all deaths. So I want to dispel that myth that I've seen out there quite a bit, that COVID isn't that concerning because the vast majority of people have underlying comorbidities. Well, that's true for almost all deaths. So, but yeah, I don't have any specifics on the very few people that may not have had any known underlying conditions.
And do we know if people are finding out that they have underlying conditions that may not have known prior to getting COVID?
I don't have that kind of information on this.
Thank you.
Dr. Roussin, Lanette, Cam McIntosh from CBC National one more time here. Got a question actually from someone doing contact tracing. Dr. Roussin, you had mentioned people working from home. Is it possible to have contact tracers working from home, and for that matter, other healthcare staff that aren't working on the front lines right now?
This is something that's being looked at, to be able to have, say, public health nurse or other contact tracers working virtually. And so yeah, that is something that's being worked on.
Thanks, everyone. This concludes today's media briefing.